everyone, I am Dr. Vidhu, your pediatric faculty at MedPG. Yesterday we have completed our INICET 2024 exam. So in pediatrics we have got around nearly 20 questions from pediatrics. Most of the questions are your direct questions first. And secondly we have completed like 3/4 of the questions that have come from pediatric part we have completed in our TNT session and also in your previous year questions. Okay, I'll just tell you the answer and just a mild explanation for each question. I've covered here just nearly 10 questions. Okay, fine. Yes, going off with the first question. From newborn, we have got two questions. So the first one, question is your Downey score includes which of the following parameters? And multiple options are correct here. So the Downey score, your parameters are your cyanosis, your grunting, your retractions, respiratory rate, and your air entry. So given in this question, so the options that can be included are your respiratory rate, your cyanosis, and your grunting can be included, and your feeding is not being included. So the Downey score components includes your respiratory rate, cyanosis, and grunting. These are your answers. Next, going off with the next question, the ensure is used in which of the following? Option A, it is RDS, B, birth asphyxia, C, neonatal jaundice, fourth is apnea. Ensure is a technique that is mainly being used to give your surfactant, to institute the surfactant. So ensure meaning your intubate, give surfactant, and you extubate. Fine. So ensure technique is mainly used for a child with respiratory distress, mainly the child with a hyaline membrane disease, mainly in our preterm children. The hyaline membrane disease, now the terminology is your respiratory distress syndrome, that is your RDS. So ensure technique is used in RDS. Fine. Yes, going off the next question we have got regarding our short stature. So here a 13 years old child has a short stature with an upper segment by lower segment ratio is 0.8. Normally in a child with of 10 years of age, your upper segment by lower segment ratio will be nearly equal to 1. Here it is 0.8. That is meaning your upper segment by lower segment ratio is being decreased. So when your upper segment lower segment ratio is decreased, which part is mainly affected? Your numerator part, that is your upper segment part is being affected. So which are the conditions your upper segment part will be affected? Whenever your vertebral column is getting affected in any of the disease, your upper segment by lower segment ratio will be decreased. So coming to the options, we have achondroplasia, hypothyroidism, rickets, and spondyloepiphyseal dysplasia. So given in the first three options, that is your achondroplasia, hypothyroidism, and rickets, mainly your lower segment, that is your lower limbs will be affected, and not your upper segment or your upper part, that is your vertebral column will not get affected. So the answer to this question will be your spondyloepiphyseal dysplasia. Supposing if you don't, you do not know anything about your spondyloepiphyseal dysplasia, you can just do the question by your eliminating options. So by eliminating option, you have to eliminate achondroplasia, hypothyroidism, and rickets. Why? Because mainly affects your lower limbs, not your upper segment, that is your vertebral column is not being affected in the first three options, while in your spondyloepiphyseal dysplasia your vertebral column is getting affected. Fine. Okay, going on to the next question. Here we have two questions. I've got two questions in our growth, right? One is regarding our short stature. Fourth one is, regarding your head circumference. So head circumference increase in the first 3 months of life by dash per month. Sorry for the interruption. Yes, continuing with our recording here. Yes, your head circumference increases in the first 3 months of the life by 2 centimeter per month, and in the next 3 months of the life by 1 centimeter per month, and for the next 6 months it is 0.5 centimeter per month. So they have asked the question as first 3 months of life. So for first 3 months of life, your head circumference will increase by 2 centimeter per month. Okay. Yes. Next. Which of the following is not seen in a nutritional rickets? So normally the nutritional rickets occurs because of a dietary deficiency in either your vitamin D, calcium, or phosphorus. Fine. So whenever your calcium is being decreased, there will be an increase in a parathyroid hormone, that is your PTH. Your parathyroid hormone gets increased to compensate this calcium. So whenever there is an increase in your parathyroid hormone, what are the actions it will do? It will cause resorption of the calcium from the kidney. Second, it will cause an absorption, increased absorption of calcium from the intestine. Third, it will cause resorption of calcium from the bones. So this increased parathyroid hormone will compensate your low calcium, thus leading on to your serum calcium will be normal in a child with the nutritional rickets. The child will have a decreased phosphorus level. Why? Because of your increase in parathyroid hormone, there will be an increased excretion of phosphorus, which will lead on to your hypophosphatemia. So the answer for this question, that is they have asked, which is not seen in nutritional rickets, that is your increased urine calcium by creatine ratio will not be seen. There won't be an increased excretion of calcium in your urine. Instead of that, there will be an increased excretion of phosphorus. Okay, we have finished this question. Going off to the next question. This is a very nice question. Here, 13 years old male child presented with to you with an SMR of 5. SMR of 5 meaning your sexual maturity rating. That is your Tanner staging. The child is in 5. That is your adult stage. The child has attained the adult stage at 13 years. So that is meaning the child is having a precocious puberty with short stature and BP is 130/80. That is the child is having hypertension also. So what enzyme will be deficient in this child? So going on to the question, whenever there is a deficiency of 21 alpha hydroxylase, which is the most common enzyme that is getting deficient in a child with congenital adrenal hyperplasia, the child will have a hypotension and not a hypertension. Next, in a situation with 3 beta dehydrogenase deficiency or 7 alpha, 17, 20 alpha hydroxylase deficiency also, the child will not have a precocious puberty. The male child will have a undervirilization. So the answer to this question will be your 11 beta hydroxylase deficiency. Yes. Going on to our next question. This is a very direct question. Which of the following, which is not seen in your Kawasaki disease? So your Kawasaki disease, the child will have a fever for more than or equal to 5 days. Along with the child should have all other among the 5 components, the child should have the 4 components. That is, the child should have a non-purulent conjunctivitis with a strawberry trunk with the rashes that can be pleomorphic also. Next, the child should have a cervical lymphadenopathy. And fifth, the child should have an edema of your hands and feet. So the answer for this question, which is not seen in your Kawasaki disease, is your purulent conjunctivitis. Is not